Hello everybody. Today I want to give you overview on the lingual orthodontic technique, a kind of introduction, because now after around 40-50 years that people are doing lingual orthodontics, it's about time to understand all the different techniques, what they represent, what is the reason for us to choose one technique over the other. The book Lingual and Aesthetic Orthodontics, published by Quintessence, went into the market a few years ago, but it's still updated. So if you want to have most of the information that is presented here, you can see in the book. I also conduct many lingual courses around the world. You can look at the website lingualcourse.com or lingualnews.com and get information on basic, advanced laboratory courses and also many literatures. Most of it is free. The first book that I did on lingual was in 1998, kind of a history. Some of the users that see this movie probably remember this nice book. We will try to give an overview from a very basic brackets to very complicated techniques and technology. The first bracket that came into the market, or actually the first famous one, was by Craven Courts, the Omko 7th generation. This is still used by many clinicians around the world, although that Omko is not manufacturing it, or at least not promoting it. This bracket is quite big bracket. It has a bite plane in it, it has hooks, it has a very big insertion for the wires. It helps the doctor very much. We get a lot of help by zooming our brackets to a big one, which gives us a lot of options to put elastic modules, elastic ligatures, class 2 elastics, and etc. The Omko bracket, the Generation 7 bracket, has also the advantage or the property of having an occlusal insertion. This occlusal insertion of the wire gives us a very good control of the torque. This is very nice because for a vertical insertion, the torque is not so easy to achieve. Another thing that happened with this bite plane is that the mandible goes a little backward, and this creates, at least temporarily, create a class 2 elastics. And the other feature of this bite plane is that we get intrusion, a natural intrusion, by the patient biting on the bracket at least 2,000 times a day, just these intrusion forces. Not always it is recommended. Now, today the brackets are divided into 3 categories. One is a 2-dimensional brackets. 2-dimensional means brackets which has no torque possibility in them, or at least not planned or built in the brackets. Some of the brackets can be forced to be 3-dimensional, but they were not planned to be. An example of such a bracket which is very famous and very nice, very simple for the doctors, is a 2D fluorescent bracket. It's a simple flat bracket. It has 2 hooks, sometimes 3, that can be bent out and bent in a sort of self-ligating bracket. And actually this bracket holds the wire, doesn't give it a lot of properties, no values of torque, inclination, angulation, only alignment. And this is used for today for 6 teeth alignment, very small minor tooth movement, what is called today MTM, a minor tooth movement. Adenta has another option of 2D bracket, which is called Joy. The difference between the Adenta bracket and the Forestodent bracket is that the slot is perpendicular. It's rectangular. So we can actually get torque if we want to. The only problem is that the bracket itself has no torque properties. So if we want to get torque properties, we either have to put something on the back of the brackets to get these torque properties, or use wires which are bended by robot like in SureSmile or the Silly robot that gives us this angulation for this joy bracket. The advantage of these two brackets, the 2D and the joy, that they are very small, very convenient to the patient. In the joy bracket, another advantage that we can use also an elastic model. Some people will say that this is disadvantage because the orthodont has clips, but try to bend the clips when the patient has teeth that move and very painful, and you want to open these clips, and the patient sometimes crying from pain. So sometimes better to have elastics that you can easily take out and take in. Another bracket, 2D concept, is by GAC. It was previously called the MTM. Today they call it Eclipse. And this is a small self-ligating bracket. You can open it. It's very, very similar to the Innovation, but smaller, and has less torque value, and therefore it's more flat, and very, very nicely used for small teeth movement, MTM, minor teeth movement. There is, of course, the STB bracket. The STB bracket is, again, a 2D bracket that can use for 3D. Because the slot is rectangular, and because every bracket can have a composite pad that we add and change the angulation of the bracket, and by that adding torque, then each 2D bracket, at least if it has rectangular slot, can be transformed to be 3D brackets. But initially this STB bracket was not planned to be 3D, it planned to be 2D for small alignment of teeth, which is very nice because we have many alignment of teeth, especially in adult patients that do not need torque movement. And this is example of the 6 anterior teeth with the 2D STB brackets. Very small, very elegant, very easy to do the bonding. And if needed, we do some in and out bending in the wires in order to compensate for the fact that the brackets are very flat and has no in and out values. Let's go for the 3-dimensional brackets. In the 3-dimensional brackets, it's bracket that has all the values inside the bracket, which are torque, angulation, inclination. You can find different bracket for every tooth, different for the right and left centrals, different from the upper and lower premolars, comparing to other systems in the 2D where you have sometimes only 2 versions of brackets, one for the front, one for the back, same for upper and same for lower. The ORG brackets, which a few years ago was bought by 3M, it's a Chinese company that took the concept of the STB and the initially generation 7 Omko bracket and combined it into a bracket which is small, it has hook, it has straight wire values, and quite cheap to use in lingual orthodontics. It has one-piece molding, it has flat bracket, it has design of front 018 slot and back 022 for a combination technique, a dual combination technique of good control in the front and good sliding in the back. And it's smaller than most conventional lingual brackets, especially the self-ligating one, which are a little bigger. There are brackets manufacturers all around the world. This is Hero, one of the genius lingual orthodontists in the world, Japanese guy, a good friend of mine, that designed a bracket which is placed under the occlusal contact, very close to the gingiva. It has a lot of advantage being close to center of resistance, but it has also a disadvantage of being very close to the gingiva and very difficult to clean. There are some other brackets. For example, the one by Adenta, the Evolution bracket that was invented by my good friend Hato Loidi, German guy. Amazing bracket, very, very good option to do a nice ligation and also to do a part ligation, partially ligation by taking this door out and using the bracket as a bracket. Of course, the disadvantage, if we can call it a disadvantage of this self-ligating brackets, is that we need a very professional way to place them, because they should be individualized to every tooth in the mouth. So this should be done either by using a laboratory, or, as we will speak later, by putting the bracket in the best optimal place and then bend the wire with a robot like the SureSmile robot. This is an example of a case with the Evolution Adenta bracket. Today in the market we can find many other brackets like the Gestenko. It's a self-ligating composite bracket, transparent, very aesthetic one, manufactured by Gestenko, and the name of this bracket is Phantom. You can see the bracket in the mouse. Today there is a new version of this bracket which came into the market, and it's very beautiful, very neat, very easy to ligate because the door easily open and close, and very convenient for the patient, because in many patients you have reflection, especially if they have protrusion, they have reflection of the metal from the inside, and they say, why we've chosen to do lingual if everybody can see our bracket. So that's another option of a 3D lingual bracket. And you have here all the list of the advantages of this Phantom bracket. Now, the third option of brackets are the CAD-CAM. What is a CAD-CAM bracket? The CAD-CAM is brackets made by computer, by designing all the brackets on the surface of this tooth that we have scanned, meaning that we get an individual bracket for every tooth, and then a robot is bending a wire designed for these brackets. In this way, not only that we can produce or manufacture an individual bracket, but we can also reduce the size of the bracket, because the robot will compensate for all the individual variation that we have between one tooth to another and one person to another. So we don't buy brackets from the shelf or from a company, we design brackets. In this category you can find many brackets. Of course, the first one is the one that was invented by Dirk Wischmann, our friend, and which is called Incognito. And that was the first one introduced into the market. A very clever technique. Most of the brackets were made by gold, which was not only very soft and convenient for the patient, but also very easy to mold into a wax that was reproduced from the computer. And of course, there are many, many cases already in the literature showing beautiful cases with all these CAD-CAM features. Today we can find many other CAD-CAM techniques like Harmony. Harmony has few versions according to your preferences. You can have the bracket as thin as possible and then let the wire compensate for the difference between the width of the tooth and the movement. And you can have a bracket which is wide, and then the wire will be almost straight wire. And you can find an option to order something in between, a bracket that will not be so big and the wire which will not be so bent. So in Harmony you have all these three options available for you. Today we have many other techniques like Orapix, which allow you to design your brackets type and give you some option to do the planning virtually. We have today a new technique also by Didier Filion called Lingual Liberty. The Lingual Liberty philosophy is that we keep our work as simple as possible, meaning that we design the bracket in order to have a straight wire concept, meaning that with these brackets that compensate for every difference that we have between one tooth to another, we can use a preformed wire which is straight wire without any bends, and this gives a really good control for the doctor on his wire bending during the treatment. We have now coming into the market the WIN. The WIN is a new venture by Dirk Wischmann, who left Incognito some years ago and developed a new technique which I didn't try yet, but looks very promising in all the features of the possibility to control the shape of the brackets and the shape of the wires, and also the setup that we do for the treatment. Now the question is, and of course we have the eBrace. eBrace came into the market some years ago and today have quite big percentage of the market. It's very similar to all other CAD/CAM technique, but with also chrome cobalt wires, and with a very, very nice design and option to change our treatment plan in a very simple way with the correspondence with the laboratory of eBrace. This company is located also in China. Now, talking about the SureSmile, which today is what I mainly do in my office, is a completely different strategy. We go now to, we're coming back to basic, where we can take any bracket we want, we can take every treatment plan we vision, we can do simulation of many different treatment options, and all of it done in a one package. We are not combined or tied into a company anymore. This is something that we are control in our treatment back into basic. Now, in the SureSmile, we have two options. We can do everything virtually, planning our treatment and our bracket system on the computer, and I talk about Lingual Orthodontics, which is very sensitive to indirect bonding, because in buccal orthodontics we are used to put our brackets directly, but in lingual we already know that it's not easy and not desired to put the brackets directly on the mouse. So we use the computer in order to choose the brackets that we want, the slot size that we want, and then we put the brackets on the virtual model, place it on the brackets, on the teeth, change the location of the brackets if we want, do all the treatment plan on the computer. We can of course get the help of the SureSmile technicians, but you can change it and control it your way without any problem. This is a very user-friendly software. From the software, after we design all the planning, and we looked at the wire, and we changed the position of the bracket in order to minimize the bending, everything that you want to do, you can actually visualize on the software. So after we are happy, we go to the system and we add the gingiva and everything, as you can see here, and then we print a model, and this printed model here has the brackets which are virtually on the model, on this printed model. On this printed model we prepare a transfer tray, and then we go to the mouth. You can see here all these brackets were actually positioned virtually, and they were transferred into the mouth by a transfer tray. Here you can see after we design the wires in the SureSmile technique. And here is the case around 4 months later. The option to really being precise and in this way to shorten the treatment time and to avoid the back and forth is a huge advantage now provided by SureSmile, which for me is not another technique. This is a technology. I am sure that the future of lingual orthodontics is not with only company like SureSmile. I'm sure that all the other companies will understand that they must provide us to go back to basic, to use our own brackets and to plan our own treatment, and then get some computerized wire or computerized clear aligner that will move the teeth according to our plan. Now, in lingual orthodontics, comparing to clear aligner, we have really 3D control in a very short time, like in this case where we wanted to do a lot of upright, a lot of vertical movements and a lot of horizontal movements because of extractions. And the advantages of lingual orthodontics is aesthetic during the orthodontic treatment, increased treatment demands. We get more patients coming to our office which avoided lingual orthodontic treatment before, and because of lingual are ready to do treatment. So we enlarge our selection of patients. We get more motivation of patients because if they don't have brackets, they are ready to continue with the treatment as needed. We have better evaluation of treatment progress because you have no brackets and wires in the buccal side of the teeth, so you can evaluate the profile, you can evaluate the smile better. We have better natural cleaning because of the tongue effect. We have the labial enamel remain untouched. Today, many patients arrive to the clinic with already porcelain veneers, and we don't want to bond anything on them. And we can also look at the soft tissue during treatment, see if our teeth movement, how it influenced the lip and the nose and the chin. And we have some mechanical advantages, some of them that we don't need almost no cooperation. We get, in lingual orthodontics, better intrusion, better expansion, better mandibular repositioning, and better distalization. Most of it is because of the bite plane feature that let the expansion or distalization or intrusion happen better. If we don't want this bite plane effect, we can put our brackets smaller or gingivally to avoid this contact. There is also advantage or disadvantage by moving the bracket from the buccal side to the lingual side. We shorten the distance between the bracket and the center of resistance, which means we get better torque movement, we get better bodily movement, but we have less moments on the teeth, which sometimes is good, sometimes is not that good. The history of lingual appliance started by putting plastic brackets on the lingual side, and then Craven Courts in 1970 illustrated the first bracket that, together with Craig Andreico and Frank Muller and Jim Wildman, with the Omko technician, created the first version of the Omko bracket, which today developed to Omko Generation 7 and all to the hundreds of options we have today in lingual. And also you can find today many local lingual societies around the world, and all these study clubs or societies are not only promoting the lingual, but give a platform for doctors to exchange ideas, to showcases, to do consultation, and to hear about new ventures and new technologies in lingual orthodontics. I thank you very much, and I hope to see you in my next videos. Bye-bye.